Hey everyone, it's Dr. Marcon. This is the PowerPoint on the lab PowerPoint for the muscles of the anterior thigh and hip, and we'll also be going over the muscles of the posterior thigh and hip. So major actions of these muscles is to flex the hip or flex the thigh, as well as extend the hip or extend the thigh. There's also abduction, so abduction of the hip or thigh, so bringing the thigh away from the midline, as well as adduction, adduction of the hip or thigh, bringing the thigh towards the midline of the body. Other actions of these muscles include medial and lateral rotation of the hip and thigh, as well as extension of the knee and flexion of the knee at the leg. So the first muscles or group of muscles that we're going to talk about are the quadriceps muscle group. Quad meaning four, so there are four major muscles that make up this group. And these group of muscles are responsible for extension of the knee and can also flex the thigh. The first muscle is the rectus femoris muscle. When you hear the word rectus, that means straight. So this is a straight muscle. Its origin is the anterior inferior iliac spine of the hip. Its insertion is into the patella to the tibial tuberosity of the tibia. And its action includes extension of the knee and flexion of the hip. So this muscle right here is the rectus femoris muscle, which you can see anteriorly of the thigh. Again, it helps with extension of the knee and flexion at the hip. The next muscle in the quadriceps group is vastus lateralis. Now, as its name implies, this muscle is actually located laterally or lateral within the thigh. Origin of the vastus lateralis muscle is the greater trochanter of the femur, as well as the intertrochanteric line and the linea aspera. Its insertion is via the patella to the tibial tuberosity on the tibia, and its action is to extend the knee. The vastus lateralis muscle is also very important clinically because this muscle we use to do our intramuscular injections. We take a needle, of course, do an intramuscular injection at a 90-degree angle, and then inject certain medications such as vaccinations. It's a very large muscle and it's very convenient for intramuscular injections. The third muscle we're going to talk about that make up the quadriceps group is the vastus medialis. So where the lateralis was located laterally, the vastus medialis is located medially of the thigh. Just to correct the PowerPoint that is on Canvas, the origin of the vastus medialis muscle is the intertrochanteric line, the linea aspera, as well as the medial supracondylar line. Its insertion, like the previous two muscles, is via the patella to the tibial tuberosity on the tibia. Actions of the vastus medialis includes extension of the knee. The fourth muscle in the quadriceps group is the vastus intermedius. Its origin is the proximal shaft of the femur, and its insertion, like the other quadriceps muscles, is via the patella to the tibial tuberosity, and again, its action includes extension of the knee. Then we have the muscles that are the major thigh adductors, meaning it brings the thigh away from the midline. These muscles also medially rotate and flex the thigh. The first muscle is the adductor magnus. So magnus means it's pretty big. It's a very large muscle. Its origin is the ischial and inferior pubic rami, as well as the ischial tuberosity on the ischium. So part of the ischium here on the coxal bone. Its insertion is the linea aspera and the medial epicondyle of the femur. Action of the adductor magnus, of course, is adduction of the thigh away from the midline, as well as flexion and medial rotation of the hip. So we can see this large muscle here being the adductor magnus. Next is the adductor longus muscle. This muscle here, the adductor longus muscle, its origin includes the body of the pubis, so the body of the pubic bone. Insertion is into the linea aspera. Action of the adductor longus, again, is adduction of the thigh, as well as to flex and medially rotate the hip. Then we have adductor brevis. So brevis means it's small. So we have the adductor magnus, that large muscle that's located more medially, the adductor longus, which is this muscle right here, and finally the smaller adductor brevis. Origin of the adductor brevis muscle is the body and inferior ramus of the pubis or pubic bone, and its insertion is into the linea aspera of the femur. Again, its action is to adduct the thigh and medially rotate the hip. The next thigh muscle is the pectineus muscle. We can see this cut muscle right here is the pectineus muscle. Origin of the pectineus muscle is the pectineal line of the pubic bone, or the superior pubic ramus. Its insertion is between the lesser trochanter and the linea aspera, or the pectineal line of the femur. Action of the pectineus muscle is to adduct the thigh and then flex and medially rotate the hip. So notice these adductor muscles have the same actions, adduction as well as flexion and medial rotation of the hip. We also have other thigh muscles that you'll be responsible for. This next muscle is this long Sartorius muscle. It looks like a belt. The Sartorius muscle has its origin on the anterior superior iliac spine of the ilium, and it will insert into the medial proximal tibia. So we can see that it inserts here on the medial aspect and the proximal aspect of the tibia. The action of the Sartorius muscle is flexion, abduction, and lateral rotation of the hip, and also helps with flexion of the knee. This muscle helps with football passing as well as cross-leg sitting. So here on this bodybuilder, we can see this long strap-like muscle going from the lateral aspect of the hip to the medial aspect of the tibia. So this muscle right here is the Sartorius muscle, and you can even see it on the other side too, coming from the anterior superior iliac spine to the proximal medial aspect of the tibia. The next muscle is the Gracilis muscle. The Gracilis muscle is that inner thigh muscle right here, located right next to the adductor magnus. The Gracilis muscle has its origin in the inferior ramus and body of the pubis. Its insertion is inferior to the medial condyle of the tibia. Action of the Gracilis muscle is adduction of the hip, as well as flexion and medial rotation of the knee. So here is that Gracilis muscle, that inner thigh muscle. I like to think of that muscle as the muscle that helps us kind of do that Suzanne Summers exercise when we place that equipment between our legs and the thigh master. So the Gracilis muscle kind of helps us with using the thigh master along with the other adductor muscles of the thigh. The next muscle is the tensor fasciae latae. Fasciae latae. So this muscle right here is the tensor fasciae latae. Its origin is the anterior superior iliac spine and the iliac crest here of the ilium. Its insertion is into that IT band, or the iliotibial tract, that goes all the way down to the proximal lateral tibia. So here we have the tensor fasciae latae at the superior part of the IT band, and here is that iliotibial tract that goes to the, again, proximal lateral tibia. Its action, the tensor fasciae latae, is to abduct, so meaning it brings the thigh towards the midline. So abduction and flexion of the hip. Plus, it's a fun muscle to say. Tensor fasciae latae. fasciae latae. All right, you sashay away now. Other structures that we have to take into consideration for the anterior thigh, we will see the femoral artery, the femoral vein, and this large vein that goes along the entire length of the lower limb. This is the great saphenous vein. It's a superficial vein that in most cadaver specimens of the lower limb, you will see go from the proximal portion of the lower limb all the way down to the distal portion of the lower limb. So it traverses the whole entire lower limb. And the nerve that we are most concerned about is the femoral nerve. Next, we'll go into the muscles of the posterior thigh and hip. And the first muscles we'll talk about, the first group of muscles, are the gluteal muscles, our butt muscles. The muscles that we're using right now to sit on our bottoms while we listen to this lab video. So the first gluteal muscle we'll talk about is the gluteus maximus. Maximus means it's the biggest out of all of them. So the gluteus maximus has its origin in the superior ilium as well as the sacrum and the coccyx medially. Its insertion is into the gluteal tuberosity and the iliotibial tract. The main action of the gluteus maximus muscle is to extend the thigh. The next gluteal muscle is gluteus medius, right here. So gluteus medius, its origin is the lateral surface of the ilium and has its insertion into the greater trochanter of the femur. The action of the gluteus medius muscle is to abduct and medially rotate the thigh. So bringing the thigh away from the midline and medially rotating it. The next gluteus muscle is gluteus minimus. Now we can't really see gluteus minimus unless we take away the maximus and medius muscles. So we need to reflect these muscles away so that we can get to the gluteus minimus. The origin of the gluteus minimus is the lateral surface of the ilium. Its insertion is into the greater trochanter of the femur. And action again is to abduct and medially rotate the thigh. So notice that there's a common theme among the gluteal muscles with regards to action. Now we'll get into the major thigh extensors that also flex the knee. So the hamstrings are the muscles in the posterior thigh that will extend the thigh and flex the knee. The first muscle we'll talk about is the biceps femoris. The biceps femoris has its origin in the ischial tuberosity of the ischium in the hip bone, as well as the linea aspera and the distal end of the femur. Its insertion is into the head of the fibula. Notice that there's an L in the word fibula, so we know that the fibula is that bone that is located in the lateral part of the leg. So the biceps femoris has its insertion into the head of the fibula as well as the lateral condyle of the tibia. Action of the biceps femoris, again, extension of the thigh as well as to aid in the flexion of the knee. And here is that biceps femoris muscle. So this muscle is the muscle that is located more laterally. The next muscle is the semitendinosus. Now the semitendinosus has, it's kind of a misnomer because it sounds like it's a tendon, but it actually, towards the distal portion of this muscle, it looks like a very long tendon. So you can see the long tendon of the semitendinosus. The semitendinosus has its origin in the ischial tuberosity of the ischium and will have its insertion into the medial aspect of the proximal tibia. So the tibia being the most medial muscle or medial bone of the leg. Action of the semitendinosus muscle is extension of the thigh as well as flexion of the knee. Semimembranosus is more medial. We can see the semimembranosus here. Its origin, again, is in that ischial tuberosity. Insertion is into the medial condyle of the tibia. And again, action, just like most muscles of the posterior thigh, is extension of the thigh as well as flexion of the knee. So here is the semimembranosus right here. So we have biceps femoris, we have semitendinosus with that nice long tendon towards the distal end of the muscle, and then more medially is the semimembranosus. For me, normally you will see semitendinosus kind of sitting on top of semimembranosus if you ever get to see the gross specimen. So again, the structures that we are most concerned about are the femoral artery, the femoral vein, as well as the femoral nerve. Posteriorly, we'll be able to see the sciatic nerve. The sciatic nerve will divide into the nerves that innervate the lower leg. So the sciatic nerve will then bifurcate and branch into the common fibular nerve, so this nerve going towards the fibula laterally, and then the tibial nerve going medially. And that is the PowerPoint on the muscles of the anterior and posterior thigh, as well as the gluteal muscles.